It's Thursday, April 30th, and we thank you for tuning in from throughout Newfoundland and Labrador and across the country. My name is Kathy Dix Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for today's question and answer session. For today's event, we are joined at the table by Premier Dwight Ball, the Honourable John Hagee, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Well, good afternoon, everyone. I would like to start today with sending my sincere condolences to the Canadian military family. Today we are grieving as they have lost one member and 5 other members are missing due to a Canadian military helicopter crash during what was a NATO operations between Greece and Italy. Our thoughts are with the families, their friends, and all of those who have been impacted by this tragic event. So today we are releasing our plan, NL Life with COVID-19. A plan that provides Newfoundlanders and Labradorians with a look at what life will be like as we live with COVID-19 in our province. It is a virus that spreads quickly, a virus that has already taken 3 lives in our province. A virus that we must now try to live with, so we adjust to a future that is a new normal. Life as we know it will be different. This virus has affected the way that we've been living for the last 6 weeks, and it will affect how we live our lives going forward. But the plan that Dr. Fitzgerald and her team have put together will provide us with a guide on how we can adjust our lives living with this virus. We cannot wait this out. We must adapt and adjust our lives living with COVID-19. So on behalf of all Newfoundlanders and Labradorians and to Dr. Fitzgerald and her team, I want to thank them. Also thank the officials that we have at the Health and Community Services Department and our public servants in general who have been working around the clock to ensure that we get this work done. And as Minister Hagee said yesterday, most importantly, not just get the work done, but get it done right. That remains our priority. Our priority will always be putting your health and safety first. With that, I'll now ask for you to give you your undivided attention as Dr. Fitzgerald will now just walk us through her presentation today.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. So we have reached a turning point with COVID-19 in our province, thanks to the incredible efforts of Newfoundlanders and Labradorians who have shown relentless spirit and determination in the face of adversity. As the Premier referenced just now, I will outline for you the plan that will lay the foundation for living with COVID-19 in our province. We are calling this Life with COVID-19 a foundation for living with COVID-19 because, as we have said often, this virus will be with us for some time to come, and our goal is to learn to live in a way that reduces its spread while still allowing us to enjoy many of the freedoms that we had before. It's really kind of hard to believe that we're only 4 months away from the first cases of this disease being described in China. And within a month, we had our first case in Canada, and it was only 6 weeks ago that we had our first case here in the province. And here we are today with 258 cases, or as of yesterday. I put this here as a reminder of just how new this virus is. We are still learning much about COVID-19 and have changed our advice and actions based on new and evolving information. And this may continue as we relax some of our measures. So I ask for your patience and understanding in advance. So in public health, we always have guiding principles for how we approach something, and it's no different in our response to COVID-19. So we know that as we progress with our plan to move forward, it will be imperative to do so gradually with enough time to measure and assess the effect of our actions on the spread of this virus. This virus has a long incubation period and a long clinical course. It could be 2 weeks before someone knows they're sick, and 2 weeks longer than that before someone presents to hospital. So the consequences of measures we relax on day 1 could take 2 to 3 weeks to become evident. So that's why we need to be sure of what we're dealing with before we move on. So our actions have to be gradual to see what the effect will be on the spread of the virus. We will also have to look at risk assessments. So we'll have to identify risks and be able to put measures in place to reduce that risk. So that may mean that as we move through this plan, while we relax some measures, we may have to tighten others to reduce risk. We have to make sure that we protect vulnerable populations and keep them safe. Some populations are at a higher risk for contracting COVID-19 due to their living circumstances, and others are at higher risk of severe disease. So we think about people who are older, immunocompromised, and have other medical conditions, or people who live in correctional facilities or long-term care, personal care homes, assisted living facilities, people who are precariously housed, and some Indigenous communities and populations. So we must keep protection of these populations top of mind as we relax measures. We also need to make sure that our actions are based in good scientific evidence. So we'll continue to closely monitor updates from the Public Health Agency of Canada and around the world. As new scientific evidence emerges, we'll update our plan accordingly. And we'll also look at what's happening here in Newfoundland and Labrador, in Canada, and elsewhere, and let that inform our plans as well. Accurate and timely communication with you, the public sector, and the private sector will also be key in how this plan unfolds in our province. Learning to live with COVID-19 cannot be accomplished by public health alone. It will take a concerted effort from all of us, from you, businesses, governments, schools, communities, to keep COVID-19 under control and allow some freedoms to resume. As we move forward, it is important for us to keep in mind that COVID-19 is still here. The vast majority of people worldwide, and certainly in our province, have no immunity to COVID-19. Therefore, a resurgence of the virus is a significant possibility, and we are likely many months away from a widely available, effective vaccine. In this new way of life, businesses will operate differently. Workplace practices will be adapted accordingly, and public access to programs and services, while they'll be available, it'll likely be in a modified way. To do this effectively will not only require businesses, the public sector, and the general public to be fully engaged in the process, but to be supported in that as well. So as our provincial public health system works to protect us from COVID-19 on a larger scale, we are all individually still responsible for doing our part. We're going to talk about different levels of alert in this plan, but we will have to continue with these core public health measures throughout every level. So we need to make sure that we all stay informed and are prepared and are ready to follow public health advice. We need to continue to practice good hygiene, as we've been saying all along. So make sure you wash your hands, avoid touching your face, cough into your sleeve or tissue. You need to make sure you continue to maintain physical distancing and use non-medical masks if you can't. You need to stay at home and away from others when you're sick, work from home when you can, and continue to shop online and use curbside pickup where it's possible. We know from experience that these simple measures go a long way in preventing the spread of COVID-19, and indeed up to this point have been some of the most effective things that has curbed the spread. In addition to our core personal public health guidance, there are other public health measures that will be maintained as well, and these will help to reduce the importation of travel-related cases and reduce the risk of spread within the community and within vulnerable populations. So continuing to work from home and having business have flexible work from home and sick leave policies will be helpful. Self-isolation for people coming into the province, limited non-essential travel both inside the province and outside the province, restriction of visitors in hospitals, assisted living facilities, long-term care and personal care homes, one worker, one home policy for employees in assisted living facilities, long-term care and personal care homes, and as well as the prohibition of mass gatherings. These are all very important to reduce the risk of spread of COVID-19 in our communities. As we move into the next phase of living with COVID-19, we will do so carefully and methodically based on 5 alert levels. Continued surveillance and outbreak management will take place at every level. We chose alert levels as opposed to phases or stages because we want people to remember that although we might be relaxing some of the measures we put in place, we still need to be alert, vigilant, and aware. As we progress through these alert levels, there is a gradual easing of restrictions. However, we must remember that if any of our indicators show a worsening of our situation, we can tighten those restrictions again. and we will not hesitate to do so. We can move down through the alert levels, but we can move up as well if we need to. And again, we will not hesitate to do so. I also want people to understand that we will almost certainly see more cases of COVID-19 as we relax our measures. This is not unexpected, and we do have the capacity in our public health and healthcare systems to respond. Right now, we're currently at alert level 5. So we have our public health measures in place. We are doing all following public health guidance. We've restricted access to our borders. We've had isolation after travel. We've restricted all the visitation in healthcare facilities, long-term care homes. So to move from level 5, from our current state at alert level 5, a number of World Health Organization indicators should be met. And the Public Health Agency of Canada has also coincide with these indicators as well. One of these is that there are no new cases where the source of infection is unknown. So we will likely have, as I said, more cases as we relax levels, and we may see cases from time to time that are related to travel or are connected with a previous case. And these are cases that we know about, we can find, we can isolate them, we can trace their contacts, we can quarantine the contacts. So that's what we want to be able to do in public health. If we have a case where the source of infection is unknown, that's something we pay closer attention to, because it could be an indication that there is some spread within the community that we're not aware of. But we also have to remember that cases such as this could just be that somebody can't remember where their contact came from. And so, or they're not able, they may very well have had a contact but are not able to identify it. So we do need to take that into consideration. So while we say no new cases, we will be taking this into account with regard to community spread as well. So while these indicators are a great base to start from, new information as it comes in may change how we look at some of these. But for right now, from moving from level 5 into level 4, we are saying we want no new cases where the source of infection is unknown. And we need to make sure that we have testing that's widely available, which we do. Anyone right now who has symptoms can be tested, and we are testing some people without symptoms if they move into long-term care homes or personal care homes, for example. We need to ensure that we have public health capacity to detect, self-isolate, and quarantine suspected or confirmed cases of COVID-19 and to trace their contacts. Our health system must have capacity to effectively respond to a surge of new cases. And we used ICU bed capacity and the availability of personal protective equipment to help us decide that. We need to make sure we have early detection of outbreaks and imported cases, and that we can identify any of these cases and respond accordingly. And certainly we have put measures in place that will allow us to do that. And some of our restrictions on travel now have reduced the risk of imported cases. We also need to make sure that we have public awareness and engagement, and I think that's very true. Certainly the public, you are all seemingly quite aware of COVID-19 and engaged and have been very compliant with the public health measures that we've had in place. And with practicing physical distancing, we've certainly seen that within businesses such as grocery stores, for example, who have put in place measures to reduce the risk to people. So I feel that we have had good public awareness and engagement in through this whole process. So, effective May 11th, if our indicators remain as they are now, we will be moving to alert level 4. When we reach alert level 4, we will look at resuming and reopening certain businesses that have been closed, and certain activities. And when we look at these activities, we want to assess the risk for these activities. And the way we do that is to look at the number of contacts that you may run into if you go to that business or take part in that activity, and what the intensity of that contact is. So how close are you together? How long are you together? And then we also want to determine, can the business or activity put some measures in place that can reduce those risks? So depending on all of those things, we can decide if a business is a high, medium, or low risk. And for level 4, we're hoping that we will have low risk outdoor recreational activities resuming. So things like golfing, although it won't be golfing as we're used to seeing it. There will be restrictions. Clubhouses will not allow to be open, but certainly going out on the course with some restrictions will be something you can think about. Also things that are solitary outdoor activities such as trouting and hunting and of course all the things that we've been able to do all along, like hiking and biking and things like that. We're also looking at low risk non-essential businesses like garden centers, which are more outdoor businesses, and personal service businesses such as law firms and professional service businesses, such as law firms, accounting firms, financial services. These types of businesses can resume. The resumption of some medical procedures in the regional health authorities will be considered. We will not be outlining them here in our public health report. We feel that the regional health authorities are certainly the best people to be determining which medical procedures can go ahead and when. And they will certainly be looking at the health system capacity and making those decisions. We will be allowing small funerals of up to 10 people, but with some restrictions in place. Obviously, physical distancing will have to continue. There will be a limited expansion of childcare centres as well. If we allow people to go back to work, obviously we have to make sure that there is childcare available for them to be able to do that. And you will note that schools are not mentioned here. And after careful consideration, it was felt that now was not the right time to safely reopen schools. And given that it is already mid-May, schools likely will not be opening before September. However, I would like to acknowledge how hard students, parents, and teachers are working to ensure continued learning during this challenging time. Effective today, 2 household bubbles can now join together. I know it's been a really hard 6 weeks, and you have been incredibly patient, so I hope that this will help to reduce some of the social isolation that we all feel, especially those living alone. So your household can join up with one other household if both households mutually agree, and you should not have close contact with anyone else outside of the 2 household bubble. So you can have a double bubble, so to speak. You should not join up with more than one household or bubble. And it's not interchangeable. So you can't decide after a week that you don't want to be in that double bubble anymore and go find someone else. You have to stick with it. So you make your decision and you stick with it. For those who work or volunteer in settings in which close contact with others is not avoidable, caution and extra vigilance around symptom screening and hand washing should be exercised between the 2 households. And if you are working and out in the public, you may want to be cautious as to who you bubble with so that you do not increase the risk to a vulnerable person in another household bubble. As I mentioned previously, continued surveillance and outbreak management will take place at every alert level, and consideration will be given to moving to alert level 3 after 28 days if we have no new cases or very few cases where the source of infection is unknown, if the infection rate in our population remains low, if our intensive care bed capacity is adequate, if test results for COVID-19 are readily available, and contacts can be traced and quarantined efficiently, early detection of outbreaks and imported cases are identified and responded to accordingly, then we can move to alert level 3. So when we move from alert level 4 to alert level 3, we will look at resuming and reopening some private healthcare clinics such as physiotherapy, massage therapy, dentistry, some medium risk businesses like retailers and hair salons. There will be a further expansion of daycare centers, obviously, or childcare centers. We need to make sure that we have that available for people who are returning to work. Restaurants will be able to operate with reduced occupancy rates, and some medium risk outdoor recreational activities such as team field sports may be able to resume. And once again, we will only move to the next alert level once we are satisfied that we have met the criteria to do so. When we reach alert level 2, smaller gatherings will be permitted. Some higher risk businesses such as cinemas, larger retailers, shopping centers, performance spaces may be able to reopen, provided they will be able to do so safely while reducing the risk to the public and to employees. Some medium risk recreational facilities such as gyms will be able to reopen, again provided they can do safely by reducing the risk to employees and the public. A move to alert level 1 will be considered if we have met the criteria to do so. Upon reaching alert level 1, we will have attained what will be our new normal for the foreseeable future. We have to be prepared for a life without mass gatherings until we can lift these measures fully. Unfortunately, that means festivals and other large events planned for this summer and early fall will not be able to go ahead. We have seen the potential for outbreaks in these types of large gatherings, and the risk is just too high without a vaccine. Also, vacations this year will have to look different. We encourage you to vacation close to home. International travel as we knew it in 2019 will not be feasible for the foreseeable future. Consideration of lifting the long-term public health measures at this stage will depend on the evaluation of transmission patterns of COVID-19, both in our province, across Canada, and then really around the world. It will also depend on the availability of an effective vaccine or treatment, and our continued capacity to conduct public health surveillance, contact tracing, and case identification. So in conclusion, I'd like to emphasize again that de-escalation of the public health measures in place must be slow and deliberate. We must do this right. The stakes have never been higher, and your protection is our highest priority. Some public health measures will remain in place for the duration until an effective vaccine is readily available for wide distribution. Our message right now is not that we are in the clear, but rather we need to learn to live with COVID-19 for the foreseeable future. We must focus on our shared goals, not the obstacles we may face along the way. I cannot tell you that this will be easy, but I can guarantee you it will be worth it. We must be vigilant, we must be patient, and we all have a role to play to stop the spread of COVID-19. Finally, I'd like to say thank you for doing your part. We are here today because you have listened to our public health guidance. We have asked for your continued cooperation, dedication, and patience as we navigate the next phase of our journey with COVID-19. Thank you very much.
Well, thank you, Dr. Fitzgerald. And as Dr. Fitzgerald in her closing comments said that she would like to thank you, Newfoundlanders and Labradorians, well, once again, I would like to thank Dr. Fitzgerald and her team, our Health and Community Services Department, and all the public sector workers who have worked tirelessly on this plan. You can imagine it's no small feat, as we've been extremely lucky and again thankful to have this level of expertise working to protect you. As Dr. Fitzgerald has noted, after 6 weeks of Newfoundlanders and Labradorians coming together to prevent the spread of COVID-19, we are now in a position to gradually relax some of the restrictions on businesses and services within our province. It hasn't been easy. There's been a lot of tough decisions, and I think even about funerals, as all of us would have known family and friends that have had to deal with some challenging times. Our funerals would occur within our province. This is just one example of some of the tough decisions that had to be made. These decisions aren't always perfect, and these are decisions that were made to ensure that we protect you, your family, from this virus. It's been only 6 weeks. For some of you, and I know for me as well, it feels like been months where families and workers and businesses have had to deal with this challenge. We have all experienced it in our lives. Feels like it's been turned upside down to many of us. Activities that were once took for granted are now almost foreign to us. Things like trips to the grocery stores, the drugstores are now different. How we connect with our families is very different. And our work life is also very different. But as we know that Newfoundlanders and Labradorians, in the face of this adversity and the uncertainty that comes with it, we have all been inspired by the leadership that we've been seeing in all walks of life. Supported by their teams, Dr. Fitzgerald and Minister Hagee has guided this from a health perspective. We've had countless of nurses, doctors, health professionals. They've been battle-tested in the front lines of dealing with the health aspects of COVID-19. But added to that, we have seen truckers, we've seen store clerks and other essential workers step up to maintain access to the daily staples of life. Businesses have been at the forefront of working from home, and they've modified their services, how they've been delivered to you. Community groups are supporting our most vulnerable people, and we have been witness to so many wonderful acts of kindness. It is truly incredible and inspiring, and we all take great pride in how we have responded and how we have come together to weather this initial wave of COVID-19. As we continue to adapt to living with COVID-19, which is at our doorstep and in our communities, there is room for optimism, but we cannot rest on our laurels. We have to remain ever vigilant and respect the power and the impact of this virus. The message has been clear across Canada and around the world that this virus is with us until a vaccine is available. That is still a ways away. The approach that's been laid out by Dr. Fitzgerald, well, it balances a couple things. The one of relaxing the public health restrictions and how we prevent future spikes. Together, we have proven that Dr. Fitzgerald's thoughtful public health policies work. The gradual approach that Dr. Fitzgerald is laying out today, well, it lowers the risk of Newfoundlanders and Labradorians becoming infected again. But if we move too fast or stray from the best public health policies, we could compromise the progress that we are making and threaten the health of our families, our friends, and our neighbors. But it could also impact and prolong the return of our economy. So as we collectively balance the relaxing of the restrictions on low-risk businesses and services, we must also remember we have to prevent a resurgence. So we need to follow the advice of Dr. Fitzgerald and those with the expertise in this areas. For the foreseeable future, Newfoundlanders and Labradorians must continue to follow what's been tried, true, and tested public health measures. COVID-19 can spread like a wildfire, and it has no boundaries. So as we adapt to this new way of doing things, we encourage employers to maintain their work-from-home policies. We also want to ensure that the lines of communication are open and that businesses and community groups to identify and work together to adapt their activities to meet public health guidelines. These conversations will take place over the coming days and weeks. Also, tomorrow afternoon, we will have business guidance teams in place that can support the businesses that are impacted by the changes in the alert levels that Dr. Fitzgerald just outlined. So if you have an inquiry, you can call 1-833-771-0696, or you can email covid19info@gov.nl.ca. Now, we are also making changes to the materials on the COVID website, a new look and feel that will have important information about the alert level system that's been announced today, and that will be updated later this afternoon. And of course, this is the website that continues to provide you with reliable information, trusted information, and news about COVID-19 in our province. And to the children and the parents out there, we know that your summer activities might look a little different, but rest assured, we are working on our activities and team sports can safely take place. And safely, of course, is always our focus. As Newfoundlanders and Labradorians, we have been tested and we have demonstrated our ability to weather the storm. So once again, I want to thank you for your efforts. Your action have proved good so far, but let's stay the course. Let's stay laser focused and safely adapt to a world with COVID-19 in it. We started out together, we are still working together, and together we will get through this. I will now turn it over to Minister Hagee for his comments.
Thank you very much, Premier. I too would like to join with you. Having had a significant attachment to Health Services Centre Atlantic and the Atlantic Fleet, I was particularly saddened by the tragedy that befell the Stalker of the Seas, HMCS Fredericton, today. I send my condolences to them as they mourn their shipmates, and also to the base in Shearwater, who I had a connection with the chopper crew. March the 14th in this province, our lives changed, and here we are only 6 weeks later, and it seems like in some respects a very short time, and in others a very long time. We've seen a lot of hard work by public health, a lot of hard work by the staff in the Department of Health, and really the civil service in general. With diligence and cooperation from Newfoundlanders and Labradorians who once again have risen to the task, we have flattened the curve with COVID-19. But flattening the curve is not a victory, nor is it an end point. It's actually a holding measure. It's a holding measure until a vaccine and until a definitive treatment can be found. I'm reminded of a quote from Winston Churchill, who once said, "Now is not the end. It is not even the beginning of the end, but it is perhaps the end of the beginning." This plan allows us gradually to change gears and to move towards a life, an era of adaptation. The levels that are laid out are based on evidence, they're founded on science, and they take a graduated approach that, if need be, can be reversed in the event of setbacks, because we will see cases and we will see sick people over the course of the coming months because of COVID-19. And even when we get to level 1, that is not level 0. Level 0 may never come back again in the way we knew it and that we would like to know it again. It has been a real challenge even to get through these 6 weeks. And we've seen a challenge around mental health and the discrimination and shame that some people feel by feeling as though they can't cope. And there is no shame. There is no discrimination you should have to put up with. There is no shame in reaching out to the warm line, to use Bridge the Gap, or to seek help from Doorways. And I would encourage any and all of you who are finding this particularly stressful to use whatever of those resources seems to appeal to your situation better. From a health system point of view, we've seen significant changes, and the distancing has driven us more rapidly towards virtual care. I've said before, challenges 811 have had when people don't answer their phone when their public health call them back. I've now had comments from specialists in town and from family doctors that it's difficult to use the telephone because people, I think, are worried about blocked IDs or numbers they don't recognize for fear of telemarketers or scams or junk. But it's difficult. They're working through that. But if you're looking for help and you get a call from a number you don't recognize, that may be the help you're looking for. Dr. Fitzgerald referenced one of the key pieces about moving along this alert level in the right direction is health system capacity. We created that very rapidly, albeit over a period of 3 weeks. That capacity now exists. Having said that, it comes at a price. The price is the backlog of activity that would normally take place, the planned surgeries, the planned diagnostic tests, and the health authorities will now begin to look at using some of that capacity to deal with that backlog, to bring in patients for planned procedures on a clinical need, a priority basis, and similarly to work through diagnostic tests. But at the back of our minds always has to be that without any reserve capacity, we will be challenged to move to the next level. So it is going to be a balancing act, and we really do need to keep some system capacity in reserve. So again, even for the healthcare system, it will not be business entirely as pre-COVID. You've heard the value and importance of distancing. I have been a great one for harping on about the bubble. Your bubble may now be a little bit bigger, but it still needs to be protected. It still needs to be looked after, and you should respect other people's too. And I think if we bear that in mind, if nothing else, for the next little while, it'll help us move down these alert levels nearer to level 1. So hold the line. It's going to be a long marathon, not a sprint, and there's help there if you need it. So with that, Premier, I'd turn it back to you. Thank you.
Thank you, Minister. And I think it's a good point near the end. There is help there for those of you that, struggle with mental wellness at this particular point in time. There's a number of supports that are available to you at, every day of the week. So I encourage you to reach out. And next week is Mental Health Week. So right now we will open it up for questions.
Thank you, Premier. For the benefit of our speakers, we have 8 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. The purpose of this briefing is to address COVID-19 issues only. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask the questions in the order that they were registered for today's call. I will call on each reporter by name, and please do not press *1 until your name has been called. This call will end at 2:59 p.m., and any further questions can be emailed. Our first questions today are from Ben Murphy of VOCM News. Please go ahead. Operator, can you check to see if Ben Murphy is registered there for a call? We'll move on to Kellyanne Roberts of NTV News. Please go ahead.
Hello?
Hello.
Hi, Kelly.
Go ahead.
Oh, sorry if it didn't do the beep. I know Ben is on the line as well. I'm just wondering, Dr. Fitzgerald, you mentioned a business scorecard in terms of where they'll fall into categories of being able to open in terms of if they're low risk, medium, and so forth. Will this be included with that business guidance team as to how people will understand where they fall?
Yes, so that information will be provided to the people who are helping businesses try to navigate this. So, yeah.
Okay, thank you. And getting some confusion on this double bubble, for those who work with long-term care homes and can't work from different facilities to different facilities, does this impact them joining a bubble with someone?
So, no, presumably they're in their own household bubble. So the purpose of this is to extend your bubble to somebody who's either a family member, another family household, or a very close friend family household, right? So it's not likely to impact. No.
Great, thank you. And in terms of camping...
That was two questions.
Oh, sorry. Yes.
Yeah. We're going to go back to Ben Murphy now of VOCM News. Please go ahead. Operator, are you able to manually open Ben's telephone line there so he can ask his questions, please?
Unfortunately, no, Mr. Ben Murphy. If you are able to press *1, please.
Ben, I'm going to ask you to hang up and call back, and I'm going to move on to Peter Jackson of the Telegram. Please go ahead.
Hello.
Hello.
Can you clarify when gatherings will be allowed? I realize you have the funeral home
situation in level 3, I believe. But I'm just trying to get an idea of when you expect people will be allowed to have gatherings of, say, 10 people or whatever in a socially distanced kind of way.
Yes, so level 4 is when we are allowing funerals to have up to 10 people, and gatherings will be allowed in that respect as well. But what we have to remember about gatherings, we're not talking about getting together with your friends to have dinner or something like that. You still need to stay within your bubble. These will be organized gatherings such as funerals and other ceremonies like that, where people can be socially distanced and will not be interfering with each other's bubble, where they'll be, make sure there's hand sanitizer and all of those sorts of things, to make sure that there's not this interference in each other's bubbles. So it's not to say that you can get a bunch of 10 friends and run out to the park and play around. That's not really what we're talking about here. We're still talking about physical distancing, but for some situations, and I know that the funeral prohibition has been so difficult for people, so we want to recognize the importance of these types of religious ceremonies, and for people to be able to grieve and say goodbye appropriately. So that's sort of the basis for that decision. And that's the intention of that decision. It's not that 10 people can get together and hang out.
Okay, thank you. And given the fact that people have been basically away from contagion, a lot of other contagions as well for several weeks now, are we expecting any problems with natural immunity in the population to other sorts of contagious diseases?
Are we expecting that it will be lower? Is that what you mean, or?
Yes, that people will be more susceptible to viral infections in general, not only COVID-19.
Yeah, so I mean, for a lot of people, your immunity to viral infections will last more than one season. For many viral infections, if you get it, you have immunity for life. So there are, and if we're thinking about influenza, a lot of people have gotten flu shots, and some people may have some immunity having been exposed to influenza earlier in the season. So we may see that, absolutely, but it's a little more complicated than because many of these diseases have been around for a very long time, and so most of us have some level of immunity to most of these diseases. But COVID-19, of course, is brand new. Nobody has, unless you've gotten sick, 258 people, I suppose, have immunity, but in our province. But we don't know about the number of other people that may have been exposed that we don't know about. But the level of immunity is quite small compared to the total population here in Newfoundland and Labrador.
Thank you.
Ben Murphy, please go ahead.
Hello?
Hello.
Hi, Ben.
Hi, go ahead.
No, finally. Okay, sorry. Thank you. Dr. Fitzgerald, I was just wondering, why not allow, let's say, a single visitor into hospitals, assisted living facilities, or long-term care and personal care homes?
So at this point, we're still really early. And as I said, we have to protect these vulnerable populations. We've seen the tragedy that has happened in many long-term care facilities and personal care type homes across the country. We don't want that to happen here. So I know it's incredibly difficult. I've worked in long-term care. I understand the importance of family, visiting people who live in long-term care. But I think at this point, we're weighing the risks and benefits. And the benefits right now of having people come into the nursing homes and to personal care homes, it just does not outweigh the risks at this point in time.
And I just wanted to go back to schools there briefly. I know you mentioned how it's very, very highly unlikely that schools will reopen due to the timelines that have been laid out here. So why not just give a firm direction that schools are not going to reopen this year?
Well, Ben, I think if we, you're right. It's a good question. I mean, I think if you read between the lines there, it's very unlikely that schools, can open. But we need to work with the NLTA and work with the English School Board District, and with the evidence that we have here, with us, it is very unlikely. So I think I take your message. We need to get this message out loud and clear that the schools as it existed pre-COVID-19 would not open. But let us get that. We'll get that message out from the school district itself. But we've always said that the continuing learning, as we mentioned even again today, there's still time here for continued learning for the remainder of the school year.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Dr. Fitzgerald, I know there's already lots of people who are trying to figure out who they're going to double bubble with. For example, grandparents who may have two sets of grandkids. What's the risk if they say, you know what, it's just an extra household, we'll just add them in and I want to be able to see all my grandkids?
So I think the risk is if you're a grandparent, and especially if you're a grandparent who's older, or if you have medical conditions, you have to think about that. And then you have to ask yourself, is it really wise to expand my bubble at this time at all? And just because you can do it doesn't mean you should or you have to. So, you have to think about that. And then families have to think about who they're joining with and make sure that they're making those decisions with the best interest of people in mind. But as I've said before, if you're expanding your bubble beyond that, then you're not just expanding it to those people, you're expanding it to everybody that those people have interacted with. So the fewer interactions outside of your bubble that you can have, the better. So you need to be very cautious about thinking in that way.
You've mentioned that vacations will certainly look very different, no international travel. There's still no non-essential travel within the province. When do you expect, or at what sort of depth would that expand to allow people to have staycations, for example?
We would certainly have to look at the epidemiology within the province, and we'd have to look at what we expect the infection rate to be in our population, if we were seeing cases, the percent of positivity in our lab results, testing that we have done. So there's a lot of things that we would have to consider before we could make those types of decisions. So it would very much depend on the epidemiology in the province as a whole, but also within regions as well. So if we were seeing a lot more cases in one particular area, that might make a difference to what we do. So it's very difficult to predict it at this point. We don't know. We don't have a crystal ball, as the minister has said before, to look into the future and see how these measures are going to have an effect. Many of the results are dependent on how we fall in line with the guidelines and with the recommendations at this point. So it's very difficult to predict that with any kind of certainty at this point.
Our next questions are from Drew Brown of The Independent. Please go ahead.
Am I on?
Yes, you are.
Oh, perfect. So I was just wondering if we could get a little bit more information about the business transition teams that were mentioned as starting tomorrow to get people prepared for reopening on the 11th.
So the business guidance team you're talking about there, Drew?
Yes.
Yes.
Sorry. Yeah.
Yes. Yeah. It's a good point there. So this is really with the alerts that the chief medical officer has just mentioned today. So, you can imagine the number of questions that, businesses would have, those that provide services. They're going to want to know, does this impact me? Or if I do, what are the guidelines? So this is really just continuing to work together. And it's one of the reasons why, from the language, the response from the chief medical officer, that we've taken, some time here announcing it today, but really it's the 11th as the effective date. So giving, this timeline, the opportunity to actually work with those groups to let them know what the impact of these alerts would have on their businesses.
Mm-hmm. Can you tell us anything about the composition of these business guidance groups? Are they civil servants or other people?
So there's two groups here. One that we talked about yesterday. One about dealing with economic issues, and that's the group that's includes all the deputy ministers and as they work with the ministers in that departments. The business guidance team that we're talking about here that's mentioned, we'll see some information on the website today. That's a little different group, and they're providing the answers to the business community and those that provide services. So these would be members of, public health would be involved in that as an example. So this is not the economic piece. This is really about how the alerts are impacting their businesses and how could they safely operate in this environment.
Thank you.
Our next questions are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
About the level 4 to level 3, it has two mentions of childcare. One is in level 4 is limited expansion of childcare centers, and then it's further expansion of childcare centers in level 3. So I was wondering exactly how is that going to unfold, and what are those differences?
So we'll certainly there'll have to be engagement between education and early childhood development and their daycare or childcare providers to determine what's the best way that's going to roll out. Obviously, public health will give advice as to what recommendations would be to reduce risk and some mitigation measures, but ultimately the education and early childhood development, along with their childcare providers, will have to develop the process for that.
Yeah, so one of the questions that always comes up as you start making changes and putting more people back in the workplace, as I mentioned yesterday, and even going back to the previous question, is once you add the complexity of the public health measures, to what's happening out there in the economy, as people start going back to work, one of the first questions that they ask if you're a young family is, what about childcare services? So you have to make sure that you can deliver the childcare services safely, but yet those people that are being, have the opportunity to go back to work, that is one of the first services that they will be looking for. So this is where where it's important that all sectors work together, from the departments to the childcare centers and with public health officials, to make sure that we have the proper connections and that those services can be all delivered safely.
Right, and it's come up before in previous briefings, but there may never be a vaccine that works on COVID-19. It could mutate into COVID-20 before any of the vaccines currently being developed can work on people. So if no vaccine is developed, could that mean that we never leave level 1?
From the point of view of what may happen, there's two threads. There are at least 5 different research activities as far as vaccines are concerned, because there are that many different types. 2 of them are somewhat experimental, but the other 3 are well tried and tested. The second piece is actually around treatment. There are ongoing trials, and unfortunately, as with most trials, the initial hype from the manufacturer doesn't prove to be substantiated later. But that doesn't mean to say that with the global efforts here, you might not have some form of drug or therapeutic mitigation of the disease itself. But I mean, if you go back to influenza, which is a virus biologically not dissimilar from this in some respects, that mutates frequently, we actually have a pretty effective composite vaccine each year for the 4 most common strains or 3 most common strains of flu. It took us a while to get there, and our challenge with that is actually getting people to take the vaccine, but it's there. So it may well be that you won't get a vaccine this year, and you may well have a mutation, and then at the end of it you end up with a method for producing next year's vaccine in the same way we do with flu. So that means instead of 18 months, it'll be 24 months or 36 months to get from level 2 or level 1 to whatever state life becomes thereafter. So again, it's not about beating the virus. It's not about putting it behind us. It's about living with it and adapting to it and getting used to the fact we have to be careful and do things differently.
Thank you.
Operator, I ask that you not end our call at 2:59 p.m. We have 2 reporters left to ask questions. So next we'll go to Patrick Butler of Radio Canada. Please go ahead.
Just as this has been asked previously, I'm starting to be confused by what was the briefing and what was the press conference. But when we start to loosen restrictions, should we expect to see an increase in cases in Newfoundland and Labrador?
That will be likely. Certainly not unexpected that we will see increased cases as people move around more. And as we've said many times, as you move, the virus moves. So as people move around more, as people go back to work, we will likely see more cases. We're prepared for that. We're looking for that. So, the important part is making sure that people are adhering to the guidelines, and if they get sick, they stay home, they get tested. We can find cases, we can trace contacts, quarantine contacts, and do just what we've been doing all along.
And Newfoundland Labrador is not the first place to announce easing of restrictions. What have you observed from other jurisdictions that have eased restrictions that might have had to add them back? Is there any cautionary tales, any information that you've sort of gleaned from looking at examples of this in other cases?
Yes, certainly around the world we've seen. A lot of places are just slowly opening up now, so we're still learning. It's an ongoing learning curve for sure, but we certainly have seen examples out of Japan where they've opened up and did so a little quickly, and then ended up having a second wave that was much larger than the first wave. So, that's part of the reason why hearing situations and examples like that is part of the reason why we put in stricter measures with regard to people coming into the province. Certainly we're certainly looking at what's happening in many other areas. In Australia and New Zealand now, they're having their school year is starting, or still ongoing, I should say. So certainly looking to New Zealand with particular interest with regard to schools. So there's lots of information to be gotten from our partners around the world.
I think one of the unique things that Dr. Fitzgerald and her team has put together is just some of the language around this, using an alert system versus a 5-point system or a phased-in system. It just gives you that sense of awareness, and it grabs your attention. But also to the point where the continuing monitoring that would occur at all levels, and there's certain indicators. So it'll be easy to communicate to people in the province how well we're doing from a public health point of view. So I think just some of the language around just simply using an alert system, it makes it a little unique to even Canadians in other provinces.
Our final questions today are from Holly McKenzie, Suitor of the Canadian Press. Please go ahead. Operator, do we have Holly McKenzie on the line?
Yes, we do. This is Holly. If you can press star 1. Thank you.
Hello?
Please go ahead.
Hi. Looking for some clarification on the resuming some public health procedures. So does that mean, I guess, starting on May 11th, the health authorities can start rebooking people for their surgeries and stuff like that kind of whenever they want, unless we go back to level 5?
It won't be whenever they want. I think there is a plan through each RHA to look at the cases that have been deferred and prioritize those on the basis of clinical need, and to start to bring some in. In the first stages, we will look at those procedures, both diagnostic and therapeutic, surgical, that will not put a great demand on beds and certainly minimize any risk of ICU admission, because we don't know what the effects of reducing our constraints in the other areas are going to be like. So it won't be business as normal, but it'll be a ramp up slowly, and that will hold over the period of level 4. When you move to level 3, again, it's a balance. We need to have hospital beds and ICU beds in reserve but staffed, but at the same time we have patients who have clinical needs that need to be met. So we're not going to see ourselves, I don't think, back to what anyone would call the usual working of the healthcare system for some months yet. I think it's going to be a real challenge, because depending on advice from public health, if we have to keep a significant proportion of our ICU beds staffed yet empty, that's going to be something of a major challenge.
Right, and will that challenge, I guess, be assessed in more detail and kind of future updates to this plan if, say, it's 6 months from now and people who need surgery still haven't been able to have them?
The issue of prioritizing surgeries, for example, particularly, has been one that the specialists and the family practitioners have been involved in a kind of dynamic interchange. Certainly, across the province, there has been a background level of surgeries that have been done that clinicians felt could not be deferred. Now, whether they're truly emergent in the sense of life-threatening at that moment, that's a decision, and it's a clinical judgment, and we and hospital administration haven't interfered with that. What this next maneuver will allow to happen is for some low-risk, low-intensity procedures to be done, for example, as outpatients or day cases. But against that, the surgeons, the specialists are going to have to go through the people they know they've deferred and say, well, this person was not urgent on March the 11th, but now it is May the 4th or May the 11th, and they can't wait any longer and have to have their procedure done. That will impact on bed availability. That may impact on ICU availability. And we'll have to keep an eye on that, because that capacity, that free space, is what's going to be our insurance should we see another outbreak over that period.
Thank you very much for tuning in. The time for questions has ended. Please join us again tomorrow at 2 p.m. at 1:30 in Moats, Labrador. Have a great evening.